So here are the specifics. It doesn't prevent doctors from proposing assisted suicide to patients. So that's actually in the bill that they can bring it up. Now, this in Canada, I can assure you, has created huge amounts of difficulty, including a woman who is about to have breast cancer treatment, being asked, well, have you considered assisted suicide, or as they call it there, MAID, medical assistance in dying? Um, that happened to her twice. You know, these are documented cases. There are many, many undocumented cases going on with this. So that's a problem. It doesn't allow doctors to opt out of discussing either assisted suicide or to refer patients to doctors who will do it. Again, this has created difficulties in Canada, where in Nova Scotia, 25 doctors resigned because they did not want to be part of this whole process. Not only that, but we know from polling that patients do not want doctors who are killing patients. It's you know, the majority of people in a particular poll I'm thinking of from June 2024 said that they did not want their doctor to opt into this program if it's passed. I don't think, you know, it would destroy, undermine the doctor-patient relationship, I feel, or further undermine it. Person who can have treatment that relieves their symptoms would still be eligible. There's no mentioning of suffering in the bill at all, which is interesting. But the way it's worded, it would include people with type 1 diabetes or anorexia or arthritis. These are possible in the wording of the bill as it is now. This is what it includes. The doctor can, quote, assist the person to take the drugs, but not to cause death. Yes, do you think maybe there's some reason to worry about that's actually problematic? And there's no requirement to monitor doctors' assessments, and there's a use of a proxy to sign the form if the patient cannot. And that, I feel, is open to abuse in a big, big way. It legalizes assisted suicide for patients whose death can be reasonably expected within 6 months, but doctors are notoriously bad at months. It's easier to tell when somebody has weeks left to live, but you cannot, most doctors, according to the studies I've read, cannot successfully predict a 6-month life expectancy. They get it wrong as often as they get it right. So that is also a problem.